Good morning, everyone. Welcome to the Business Equity for Indy Learning and Talent Opportunities Summit, or the BEI Summit. I'm Fiddian-Green, President and CEO of the Richard M. Fairbanks Foundation. I am also co-chair, along with Dr. Adrienne Sims, VP of Talent Management at One America, of the Business Equity for Indy Learning and Talent Opportunities Task Force. The Fairbanks Foundation is pleased to underwrite today's summit, which is focused on addressing how employers can play a role in addressing education and workforce disparities in Marin County and statewide, and really advancing the work of the BEI and our task force, which is focused on education and workforce outcomes. We are also so grateful for the ongoing partnership of the Indianapolis Urban League and also the Indianapolis African American Quality of Life Initiative. Their team has been instrumental to the development of our recommendations and are key partners as we work on implementation, ensuring that employers across central Indiana and beyond are implementing some of the recommendations our task force has put forth. Our task force spent last year analyzing racial disparities in education and workforce outcomes in Marin County and statewide, and also developing specific action steps that employers can take to help address those disparities. We released a report summarizing our analysis and these recommendations in November of last year. Our task force believes that businesses of all size can and should play a critical role in supporting the success of Black and Hispanic children and adults here in Indianapolis and statewide. Doing so will be good for those individuals, their families, and their communities. When students are better educated, they can find better jobs as adults. With higher pay comes the ability to earn a livable wage and help strengthen the Indianapolis and our state's economy. And closing the education and workforce gaps is also good for businesses. Almost every employer in Indiana is struggling to find the talent that they need. Growing the supply of people in our community who have the education and training that they need to participate in the workforce will help our state's employers and our economy thrive. As I mentioned earlier, our task force developed a set of recommendations that we released last November. The purpose of today's summit is to drill down on 3 priority recommendations and hear from employers and other community partners who are already taking steps to implement these recommendations within their own organizations. The 3 sessions today's summit will cover are: first, how employers can help their employees access high-quality early learning programs; second, how employers can provide work-based learning opportunities to high school students; and third, how we can help connect high school students and the adult workforce with post-secondary education and training opportunities. Our objective is for attendees at today's summit to walk away with really clear action steps that they can go back to their organizations and implement hopefully all 3 of these priority recommendations in the near future. These actions should have the dual benefit of helping to close racial gaps in education and workforce outcomes in Marin County and statewide, and also helping to strengthen your company's talent pipeline. Thank you for joining us for Panel 1 of the Business Equity for Indy Learning and Talent Opportunities Summit, focused on helping employers address racial disparities in education and workforce outcomes in Indianapolis and statewide. Last November, the BEI Learning and Talent Task Force released a report highlighting the stark education and workforce disparities impacting Black and Hispanic students and adults in Indianapolis and statewide. One root cause of those disparities is lack of access to high-quality early learning programs. Our first panel during today's summit will help employers learn what roles they can play in helping their employees and others in the community access high-quality learning programs. Our early learning panel features Maureen Weber, President and CEO of Early Learning Indiana; Carolyn Butler-Lee, Vice President of Diversity and Inclusion at Cummins; and Jamal Smith, Director of Strategic Partnerships at IU Health. Welcome. Thank you so much to our panelists for being here this morning. So glad to be with you.
Thanks for having us.
Thanks for having me. Great. Well, Maureen, I'm going to ask you to get us started with our conversation. First, provide us with an overview of Early Learning Indiana, and then give us the state of early learning and what is the state of accessing high-quality early learning programs here in Marin County, and then comparison statewide.
Wonderful. Well, thank you so much for the opportunity to be with you and to share a little bit. Early Learning Indiana is a nonprofit organization with a simple and difficult mission of ensuring that children across the state of Indiana are prepared with the essential skills that they need to thrive in kindergarten and well beyond. And we know that this is important work for two reasons. First of all, 85% of a child's capacity to learn is developed before they ever go to kindergarten. And so high quality early learning experiences have been associated with better academic outcomes, social outcomes, and a whole host of all the good things. At the same time, in a study that we did even before the pandemic, we found that employer impact of parents lacking access to high quality childcare is also very significant. In Indiana, it's about $1.8 billion annually, and I'm certain those numbers have only gone up. So we know there's a two-generational importance to this work, and so our organization does a lot of work to figure out what is the health of the industry statewide. And so I'll share just a little bit of that. In 2021, we did what we called our Closing the Gap report, which was an analysis of 4 components that we think about when we think about access. So first of all, are there seats for children? Do they have a place to go? Critically important. What is the quality level of those seats? Are they affordable for families living in that community? And then lastly, do families have choice? Is there one type of care, or is there, are there centers and family child care homes and school-based care all available in that neighborhood? And so the other things we looked at in terms of choice are infants and toddlers well cared for? Because we know that's a particular problem in Indiana. And are there extended hours? So when you work in manufacturing or healthcare, are there opportunities for folks working other than an 8 to 5 shift? And so what we found is that across the state, we're at about a 60 on a scale of 0 to 100. So we would call it just barely over the line of moderate access. And really we know, though, as you look throughout the state, about 86% of counties have inadequate access. And so looking at across those 4 metrics, about a quarter of the children in Indiana have access to a high quality seat that is available in their neighborhood. And the average cost to income ratio, so kind of a big metric, is almost 12%. The federal government says no family should pay more than 7% of their income to be able to have affordable child care. So we're doing kind of fair to Midland, certainly better than we were doing years ago, but we have a long way to go. Here in Marion County, it's a little bit of a different story than where we are statewide. We have a lot of capacity. We say that we have close to 100% of actual seats that we need. Unfortunately, we score a 56 on a scale of 0 to 100 on the quality of that capacity and the level of choice available to families in Marion County. And so we know really a lot of our work needs to be focused there, and how do we make sure that we have the right workforce and other factors to drive quality in Marion County.
Great, that's very helpful for setting the stage for our conversation. So we technically have the capacity to serve every child whose family wants them to be in an early learning program, but the quality is just not there for all those seats. Great. Well, even prior to COVID-19, and you mentioned this, a lack of early learning programs has impacted the ability of employees with children to remain in the workforce. The pandemic has, of course, exacerbated this challenge. So Carolyn and Jamal, my next few questions are for both of you. First of all, let me ask Carolyn to just provide an overview of Cummins for the folks tuning in today, and then tell us how lack of access to high-quality early learning programs has impacted Cummins employees.
Sure. Claire, first, thank you for the tremendous work and analysis yourself and Dr. Sims and the BEI task force did to analyze the information and share some really thoughtful, comprehensive recommendations. I do appreciate the work.
Thanks, Carolyn.
Cummins is, and I'm delighted to be here talking on this panel on behalf of Cummins Inc., a global provider of power solutions, and that we distribute, manufacture, produce around the world with about 59,000 employees. We are headquartered here in Columbus, Indiana, just 45 minutes south of Indianapolis. And to your question specifically around some of the challenges that we face when our employees don't have access to what they need to show up and be who they are and contribute at the highest level, it has an impact on our ability as an organization to deliver to our customers. Mm-hmm. It has an impact on thriving communities. And so these barriers to the access of childcare, when they're worried about their children's well-being, when they don't have peace of mind or a concern about safety, they can't be at their best. And then we can't be at our best in delivering and solving hard problems for our customers and supporting our communities in the way that we want to. So this impacts their engagement and it impacts their ability to be at their best.
Right. That's very helpful. So impacts employee morale, engagement, and just the ability for Cummins to deliver products to its customers. Okay, great. Well, Jamal, turning to you, could you start by providing a brief overview of IU Health for the folks tuning in to the webinar today, and then answer the same question: how has lack of access to high-quality early learning programs impacted IU Health employees?
Absolutely. And first, let me echo the appreciation for all the work and dedication that you and the team, the BEI committee, has committed to this effort, creating a platform to continuously express the concerns over the lack of access and disparities that exist for early child care and other educational opportunities and attainment. IU Health is the largest healthcare provider in the state of Indiana and one of the largest employers. And that is our core business model, right, is healthcare. And to speak specifically to the impression of lack of access for early child care and as it impacts IU Health as a healthcare provider. First, as has been duly noted, we're obviously not isolated in that pain point. Mm-hmm. As one of the largest employers, we have some team members who have to make some pretty important decisions as to whether they commit to employment or staying home with their babies, which is not a light decision to make. And as we are providing healthcare, which we feel is an important service to the community, the Indiana community as a whole, it's important that we stay staffed up. The other thing that I like to mention too is that the lack of access is, to early child care or early childhood education, if you will, has a long-term impact that we think affects health, right? So if you can draw a correlation between the early formative years that young people have, or the lack thereof, and the outcomes of their health as they get older, for us, it's an impact to our bottom line. So not only is it important for us to directly do everything we can to provide that service to our team members, because it's important that they can serve in that capacity, but the long-term effects of not having that access, we feel impacts our bottom line. So we need to think about strategically how we address that lack of access and the quality of early child care and early childhood education, moving forward.
Yeah, so very helpful. So it's not only employee engagement, it's not only the ability of organizations to deliver products and services, but it's also impacting long-term outcomes, not only education, but health outcomes for folks in our community. Very helpful. Well, Maureen, the organization you lead, Early Learning Indiana, is often called upon by businesses to try to help troubleshoot this challenge, which Jamal rightly noted is not isolated to one or two employers. It's a community-wide challenge. So your experience informed a key recommendation that the BEI task force came up with that I'd love to have you kind of walk through and explain to the folks tuning in today. What specifically are the actions that employers can take to try to help address this challenge for their employees?
Yeah, well, the good news is there are a lot of different things that employers can do. And there was an interesting study done just in the last few months by Care.com that found that about 56% of employers offer some kind of benefit for childcare to their team members. But interestingly, another study showed that only about 10% of employees thought that their employer offered a benefit. So I think the first thing we do is we have an opportunity to make sure that people know about the good work that's happening within your employer. And then, we tried to put together a list, whether you're a large employer that may have the critical mass necessary to put together an on-site offering like IU Health and Cummins. But depending on the size of your workforce, to be able to kind of right size to what you need. So some of the other things that we've recommended are that you enable your team members to establish education savings or dependent care accounts. Those can be pre-tax benefits that help to provide those dollars directly to employers to go out, or to employees to go out and seek care. There are employers as well who make an employer match to whatever spend that their employees have, and there are ways that we can help facilitate that as well. We also know that depending on your relationship with providers in your community, you can form a partnership with a local provider to either reserve seats in that institution or to provide priority status for a wait list. We work with a number of employers that do that for their team members so that you can get to the front of the line and help to make sure that you have access. There's one other thing that a lot of employers have been doing in the post-pandemic era that is on our list, and I'll mention, which is backup care services through a service like care.com or otherwise. And the only caveat that I'll add there is that it's a very helpful first step. But if you're kind of facing the access challenges that we talked about in the first part of this panel, then you may not be giving them the benefit that you hope to be giving them if you're just sending them to a place that will tell them that there aren't really services available. So it's a good way to kind of put your toe in the water, but we hope that you take some of these other steps in addition.
Great, thank you for walking through those. So turning back to my two employer representatives, that menu that Maureen just walked through, and she briefly talked about the fact that you both have on-site care, but can you talk a little bit about which of these you've implemented and what has that meant for the challenges that you earlier shared that your employees have faced when not accessing quality care? And I'll turn to you first, Carolyn.
Sure. So we do have a child care facility on site in our Columbus, Indiana operation. So as you mentioned, Maureen, we have flexible spending accounts that are available to employees, as of course they can use for dependent care. We also offer the backup care and emergency services and scholarships as well for reserving seats in our programs. We've been more recently working on a strategy, and we've made some really good strides towards a couple of things. One, higher wages for our early child care providers, and ensuring that we have a living wage for our employees wherever they're working around the world. So that helps provide what they need and resources to have access to child care. We're also, about how do you advocate as well from a systemic change to cap cost at some level, that to address the current crisis that's happening right now. We're looking at expanding also our access to high quality child care development by providing on-site staff training to level up in skills, level up in wages as well. So those are a couple of the things that we've instituted in addition to the access to child care.
That's great. I'll ask you more questions about that, but that's super helpful. So Jamal, turning to you with the same question. Absolutely. Of that menu that Maureen presented, which are the ones that Cummins is implementing for its employees?
Yeah, IU Health.
Excuse me, IU Health. Thank you,
No,
sorry.
No, but you know what, so we too have the flexible savings accounts as well. And to be honest, for over 20 years, we've been supporting the early learning platform or the space. We have on-site or close to site, IU Health has a fairly large physical footprint. So we have an on-site, child care facility. But you know what, that's not enough. I'll lean into it saying that even with all those things, we need to do more. There's a waiting list just for us as an employer, for our team members to access. And to be honest, the on-site facilities that we've invested in partnership with ELI, not only support our team members, but the surrounding community as well. For us in providing that healthcare, it's important that, we not only consider the in-house, space, but also how we're impacting the community. So being able to expand that footprint, shorten that waiting list so that others can take advantage of it are our priority. One of the things that we are, I'll say, constructing, if you will, has been the notion of this health district that's surrounding the Indianapolis hospital consolidation, and the notion of investing in healthcare outside of the walls of the hospital, and what does that mean? And there's a number of social impediments that play, and I'm sure in the other panels that you'll address some of those, but childcare is one of those. And so how do we think about the investment outside of the walls of the hospital so that the community can take advantage? Because as we mentioned before, not only is it a direct impact to have access to that childcare, but the long-term effects of one's health and not having that early start is critical to our bottom line.
Great. Well, then I want to dig a little deeper with both of you. So there's a cost to the benefits that you're providing. So is there anything you can share with the folks tuning in about what is the investment in terms of dollars, FTE, staff time for Cummins employees to help manage a benefits program like that? And then how do you think about ROI? Why is this a good investment for Cummins?
It's a good investment for Cummins because it's good for our employees. And when our employees have can bring their full selves to work, right? Can be focused, can know that their children are healthy and safe, they can be engaged, and they can contribute at their highest levels to helping us problem solve for our customers, deliver innovative products, engage in the community. So the real return on investment is that for us, for our employees. It's a significant investment in terms of cost to implement these programs and provide full-time employees. We have about a staff of 20 plus, I think, right now at that child care service center now, which is down significantly from pre-pandemic time. And our employees are also asking for things different now.
Right.
More flexibility around those services. So as we evaluate what the needs are of our employees, that changing significantly over the last 2 years, and what they want more of is flexibility. Mm-hmm. And so continuously sort of evolving and evaluating our healthcare programs, our health benefits, our employee benefits in general, and childcare is clearly one of those. We want to keep leveling up the number of staff members that we have at the center. We're down more than half and wow. Partly because of wages and the opportunity to be able to pursue other roles. So again, this strategy that says we want these educators to be paid at a level that is competitive in the market. So the cost is significant, but the return on investment is, I would say, priceless for our employees' overall well-being and their engagement, retention, right. As well. So,
well, I might follow up with all of you about the issue of wages. That's really not in the control of an employer to handle necessarily, but I think that some of what we're talking about can help play a role toward right-sizing wages. So, Jamal, same question for you at IU Health. What is the investment? What is the FTE time, and how do you guys think about ROI?
I echo a lot of Carolyn's points. The investment is, it's expensive. Mm-hmm. But I'd argue that the lack of an investment in this space we're paying for in the long run, and I think that tag is far more expensive than the upfront investment. I mean, if you think about, look, one of our system missions, our goals, is to transition Indiana from being one of the least healthiest states in the country to one of the healthiest states in the country. Mm-hmm. Not an easy feat, right? Yeah. In order to do so, we can't work within our walls. I keep emphasizing that. We've got to step outside and walk upstream and address some of these things. Early childhood education, early child care is critical. Some of the immediate impacts, to Carolyn's point, right, is recruitment and retention. Right? We want to be able to recruit the best. We provide what we think is a critical service to the state of Indiana in healthcare, right? And we want the best to be here to do so. We also want to make sure, again, going back to our overall mission for the system, that our state is as healthy as it can be. If one's place and space within their start in education is critical to that health outcome, then we've got to figure out how to invest early on so that young people have a better chance and a better start to being in a better space as they get older, better educated, better and further employed, which data has shown has created better health insurance and access to health care, right? So is the upfront investment large? Yes. I think anybody would be naive to think otherwise. Yeah. But I think if you compare the cost of not investing, I think the upfront cost pales in comparison.
Yeah, great. Well, last question on this particular topic before I move back to Maureen is, in addition to cost, I'm sure there have been some other challenges. So can you just talk again for the benefit of folks tuning in who may not have a program like this currently, what have been some of the challenges to implementing the benefits that we've just talked about? And then are there additional opportunities and upsides beyond what you've just shared around employee flexibility and retention?
Yeah, I think simply put, as Jamal has said, and I've said as well, we just win. We know we win with the power of and through the power of diversity, equity, and inclusion, and making sure that we're making room for everybody to be successful and show up and do their best. And it wins for communities, and it wins for our customers and our bottom line by making room. And the challenges right now, we started this child care center mid-90s. So it's been around for quite some time. Yeah. Our challenges now really have more to do with the difficulty of finding qualified early childhood educators, right, to fill positions. So this decrease in the field because of wages and where we're paying is a real sort of challenge. And our employees need more flexibility. They need help with sort of 1, 2, 3 days, may not be 5 days as they're working in a hybrid. We are, at least in many of our operations here, longer hours too as well, to deliver to our customers and the challenges of a global supply chain crisis that we're still getting through. They want curbside drop-off and pickup as well are some of the things we're seeing, and overnight support as well. So those are some of the challenges we're facing now, and we are committed to making sure we're figuring out how to help solve them with our and on behalf of our employees, so that they can be engaged, we can recruit in a competitive market and retain talent.
Have you figured out how to address some of those challenges you just mentioned, or are you still working on solutions?
We are still working on solutions.
Okay, all right.
We are still working on solutions, but we're flexing with our child care center there in Columbus. And one way we have, as I mentioned earlier, is we've leveled up wages for those child care providers in our center in Columbus. So competitive wages is a way to do it, and I think that's an area we'll continue to focus on.
Great. Well, Jamal, same question, IU Health. Challenges you're facing and what you see as the upside, apart from the obvious one for your employees and those children longer term.
Absolutely. I think we share some of the same as Cummins. One that I would add is, as we are thinking about how to expand our early ed facility footprint. Right? Again, we've been investing in that space for over 20 years, but there still is waiting list.
Yeah.
So as we think about how we expand that footprint to provide additional access, the initial thought is, right, addressing that issue on behalf of our team members, right? To Carolyn's point, we want to recruit and retain the best to ensure that we are providing the best healthcare for the state of Indiana. But in doing so, we need to have and keep the community in mind as well. So as we're thinking about where that facility sits, we need to make sure that or facilities, perhaps it's more than one. And keeping in mind also, we have a statewide footprint.
Right.
So child care in Indianapolis may look different, or the needs for that facility may look different in Indy than it does in Paoli, for example.
Sure.
And we need to keep that in mind. But we want to ensure that we are not just internal facing as we think about what the solutions are, but that the community is at the front of mind as well. So thinking about access for them, and access is more than just location. It's pay, and and the financial burden as well. It's also, to Carolyn's point, the diversity and the cultural makeup of the facility and the people who make up that facility as well, right? As I drop off my child in the facility, and my thoughts about my child being safe is much more than the locks on the doors.
Yeah.
So how do we invest in that to ensure that that location speaks to the culture and the identity of the people and the communities that we say we serve? Secondly, I'd also echo Carolyn's point about the wage and the concerns over how much some of our daycare workers or child care providers are making. And that's not there are other industries dealing with that same issue, so let's not pretend this is an isolated incident.
Sure.
But sticking to topic, right? It's important that we figure out how we invest in that space to make sure, again, that organizations like ELI can recruit the best and retain the best, so that that service that is being provided for our team members in the community is as quality as it can be. So I'd start with those. Your follow-up is, what are you doing? Do we have the solution yet? I don't think there's a magic Staples button. I think the issue didn't happen overnight, and so the solution is going to take some time as well. But we are committed to seeing that through. We've invested in the last year, even through the pandemic, nearly $1 million to see how we can improve the quality, not just here in Indy, but statewide. How can we address the wage and the wage gap for some of our daycare employers, not just in Indy, but statewide? And what does that system look like? What does the quality, what does the provisions look like to ensure that that quality child care and early child ed, right? That service, is for the young people. So I think it's an ongoing effort, not something that we're going to solve. If somebody does have a magic Staples button, I'd love to see it. But I think being committed to it is the first step, and not having what I call corporate ADHD. When the wind kind of goes out, you find something else and you get. But staying true to that, to that goal.
Right.
And I think that's where we are.
Yeah. So it's not a new problem. it's been exacerbated by COVID, so you got to stick with the solutions, and those challenges keep evolving as the world evolves. Yeah, okay. Maureen, I actually do have a question for you. So these are two large employers, and we also have small, medium-sized employers tuning in today. Have you seen in your work around the state with employers that smaller companies are also implementing some of these same benefits? Is that actually a feasible option for small, medium-sized employers?
Absolutely. We see it of employers of all size. There's some great examples in other parts of the state. Certainly, dependent care accounts are one easy way that really all employers can get involved and make that available to their team members.
Okay. Is that a fairly off-the-shelf benefit that any employer could talk to their benefits provider and figure out?
Absolutely, it is.
Okay.
Yes. And if there are any questions, we're glad to help as well.
Okay, great. Well, I do have a question just about the fact that the summit is focused on addressing racial disparities, but these benefits that you're talking about are not just for one slice of your population of employees. You'd be providing this to all of your employees. So a question for you, Maureen, and then I'll ask Jamal and Carolyn to chime in as well. What we've been talking about here is a community-wide benefit, yes? So how would these benefits actually help address racial disparities in Marion County and statewide?
Yeah, I would say in a couple of ways, and it goes back to the overall question of access. This is, for all the reasons that Carolyn and Jamal have been talking about here too, it really is a flawed market for this industry. And two things are true at the same time, that organizations like ours charge more than parents can afford, and organizations like mine aren't charging enough to cover our costs. And so we just have this, profound disconnect. And so involvement from employers and certainly additional public spending as well can help to right this market so that it can function better and really allow it to work such that access gets created. Right now, there's almost a disincentive to open more capacity if you're an organization like ours, both because we can't staff it and then we can't charge enough, to fill it. And so there's a little bit of a rising tide lifts all boats approach to this.
Yep.
I will say, though, some of the things that both Carolyn and Jamal have talked about, program design really matters here, too. And increasingly, we're hearing from employers who are asking us how they might obtain a tiered benefit, a tiered discount for their team members based on the roles that the team members play or their compensation levels within the corporation. And that may be a relatively obvious one. There are less obvious ones too, and Carolyn talked about one of them. A lot of employers have relationships with child care centers that may be only open, during those core business hours. Making sure that your program, whatever benefit that you provide, it can be used, for example, in a family child care home, which, the data tells us over and over again, those are the choices that families want to make for overnight care. They're not comfortable in a more institutionalized setting. So just making sure that from the get-go, you're building that kind of flexibility into your program can help, make sure that we're addressing some of those disparities as well.
Okay. Carolyn, Jamal, anything you'd add to that same question? Like how is a benefit that's provided to all employees actually helping to address racial disparities in our communities?
As Maureen said, this sort of rising tides help all boats rise. We take a holistic approach and are looking at mitigating disparities and inequities, what we can do internally within our own workforce, externally as well. And part of that for us starts with ensuring that our workforce represents the communities where we operate around the world. That means we want to ensure that our Black and Latinx representation, our gender representation mirrors the communities where we operate and the talent pools that are available, and that we are paying a competitive wage. That creates access, that creates wealth. Yeah. Those are systemic sorts of changes. And so addressing underrepresentation where we have it, and that addresses inequities in access that exists. So a systemic and holistic approach to it, inside, outside, in the communities where we operate. And where we see gaps that we're addressing, whether they're pay equity, pay gap, any of those things, some of the things you're talking about later, those are the ways that are the kinds of systemic changes that we look at inside and outside, where thriving communities are great for us, great for Cummins, great for our employees. So we do look at tiering our out-of-pocket expenses for employees in some areas.
Yep.
So we do get a sort of after equity is about unique needs. There's clearly, as you said, legal requirements around what you can and cannot do.
Sure.
So, however, looking at equity and what unique groups and individuals need is something that we're accustomed to doing and that we do and target where we need to for improving outcomes for our employees and the communities where we live and operate and work.
Yeah, very helpful. Anything you'd add to that?
Yeah, you know what? So for me, it always ties back to education, and we talk about the lack of access to early childhood ed and the educational experience that's provided therein, followed by the lack of access for some of those in our community. You note that there's a disproportionate number of our Black and brown community members who represent the community poor, and then you talk about the lack of financial access to have these quality child care experiences. Then you loop in the data that speaks to, what happens for young people as they progress through their academic years, if having had, right, a meaningful, quality early childhood experience. A solution that speaks directly to that speaks directly to diversity, equity, and inclusion. There is no in between for that. There is no gray area. You either do it or you don't, right? And so creating a space that those who are, who lack the financial ability, right, to place their folks. Maureen mentioned, which I think is critically important, how critical program development is in this space, right? And I think that's often lost in this, right? There is the ABCs and 1, 2, 3s component of that programming that needs to be implemented and ensured, and we need to figure out how to pay for it, right? But there's also a cultural element that needs to be integrated into that program development that speaks to the culture of the communities of the people that we're targeting or that we're trying to support.
Yeah.
And if it doesn't, then it's falling short.
Yeah.
Right? There is no one-stop shop or no off-the-shelf box thing that you can put in that speaks to every community. When we do that, I think you'll see some things. Now, here again is where kind of the corporate ADHD comes into play, because the results and the data is not going to happen. If we implemented it today, right? Next year, you're not going to see drastic change. Yeah. We have to be consistent and committed enough to see this thing through and find some small wins along the way in a way to track how our young people are progressing and our families. Are being able to progress through that kind of an investment. But I do think it's critical. Program development and literally addressing the cultural creation, if you will, of that programming and the access or the financial access that many of our community members need.
So just to be clear, is that something IU Health is actually doing? You're helping to try to help recruit and hire more diverse early childhood educators and creating a more welcoming culture within the centers that you operate?
So yes, through our partnership with ELI, we're trying to address all of those things.
Okay.
Right. That's not the only thing we need to address. And keeping in mind, we have a statewide footprint. The cultural makeup of what we're trying to accomplish here in Indianapolis is going to look different than it is in Southern Indiana, and we have to be honest about that as well. So if we're going to be honest about the cultural sensitivities we have here, we have to also do the same as we travel throughout the state. So the answer to that question is yes. Have we figured out the magic code yet? No.
Yeah.
But I think through this partnership, we'll be able to crack that code and hopefully, set some examples, for what can be done throughout the state of Indiana.
Okay, great.
I can chime in on your behalf too. So IU Health recently made a significant investment in ELI to work on positive childhood experiences to combat these ACEs that we know are, very prevalent and negatively impacting young children.
What are ACEs?
So ACEs are adverse childhood experiences, and
okay.
When children have a handful of them, we can predict some really rough things about their future with a fair amount of accuracy. And so what studies have shown is that when we combat that with positive childhood experiences, and it's as easy as making sure that you have high quality interactions between adults and children in a location, that you can actually reverse the course of that trajectory. Mm-hmm. And so we've been really blessed with that involvement from IU Health and the IU School of Medicine. And it relates back to the issue of diversity and equity, because so much of that is really focused on the educator themselves. And I think it will also ultimately help with the workforce issue, making sure that educator has sort of the skills that she needs to care for herself in a way that allows her to care for children. So it all relates.
Well, I want to ask the question for the folks that are tuning in. Maureen, you actually not only operate centers here in Marion County, but do technical assistance statewide. So are you a resource that an employer tuning in today who doesn't have one of these benefit programs wants to learn more? Can they call Early Learning Indiana to find out more about how they go about doing this?
Absolutely. We are so delighted to help employers. There's also a network of child care resource and referral agencies throughout the state that operate regionally, and we can connect you with someone in your area too. So either way, we're glad to help. And we usually recommend employers start with two things. First of all, really trying to put themselves in their team members' shoes by doing a quick survey of, what are your needs and how are they being met? And we have a survey that we can provide, and are glad to share that out with you. And then the second thing is to look at that Closing the Gap study that I mentioned. And if you go on our website, you can drill in, really to look at the neighborhood around your facility. And it will give you a better sense of what access do your team members actually have. So if you're maybe, past the point in life where you have young children, you can get a better sense for what they're facing.
And Carolyn and Jamal, would you welcome other employers giving you a call and saying, hey, we'd like to just pick your brain about how you've been approaching this issue with your organizations?
I'd say absolutely. To be honest, the solution is not, this is going to be a collaborative effort.
Yeah.
I think the more of us being employers, regardless of what size, right, pitch into this effort, I think, the more likely we'll be able to tackle it before not.
Okay.
Short answer is yes.
Okay, that's excellent. Okay, well, I would love to open it up to any questions from the chat, and it looks like we may have a question.
Yes, we have a question. Are there any examples of Indy employers that provide an education savings account with a match for early learning?
Okay, so the question is, are there examples of employers that are currently providing that education savings account benefit with a match? So do you have an answer to that?
So there are a whole bunch that provide dependent care accounts in particular that separately also have either offered a match or a negotiated discount. Now You Health's a good example of that. We provide a discount at our facilities, any of our facilities, not just the one we operate for IU Health, as a result of a negotiated arrangement between us. So that's one good example that we point to.
Well, since we have a little more time, I'd like to drill down a little bit more on an issue you've all hit upon, which is wages.
Sure.
So I think there are some things that we've talked about today that employers can do to try to help by making sure all of their employees are earning a livable wage, which is probably a little more challenging in an era of high inflation, I have no doubt. But are there other things, Maureen, that you've seen around the state or even in your work nationally that employers can do, or is this really more of a policy issue that has to be addressed at the federal and maybe even state level?
That's a setup question.
Yes, and
Yes,
clear.
and.
I think it's definitely a little bit of both. Look, it has to start with making sure that our public sector is paying for the actual costs of care, and too often, and certainly that's the case here, it simply does not happen. The reimbursement rates are based on a market study that are based on what are kind of flawed, inputs to begin with. And so the state of Indiana is doing quite a bit of work right now to really look at actual costs and to be able to reimburse at a rate based on actual costs, which I think will bear great things over the next, handful of months. One of the things that the silver linings of the pandemic, there were very significant dollars that came into the state and all states around early care and education. And so through that, the state has provided very significant stabilization grants all across the state. As a result of that, they have gotten data about our actual costs, and so they understand more than they've ever understood before about what it takes to run an early learning provider, whether you're a family child care home or a center like ours. And so I think we're all getting more knowledgeable, and I suspect that public policy will follow.
You mentioned this in your opening remarks, and I'd like to drill down a little bit more. I think it's, when I think back on the time when I was looking for high quality early learning for my own children, and then you hear frequently from parents, young parents, that they feel like they don't know where to go to access that information. So one thing that employers can do is make sure that they are communicating that to their employees with the benefits information that they provide every year to their employees. Are there other things employers can do to try to help raise awareness and just connect their employees with young children to the available resources and not have to, call their friends and go through their what used to be the Rolodex, but now your iPhone contact list to figure out where do I go to send my child where I'll feel comfortable that they'll be safe and well cared for.
It's a challenge, and it's a particular challenge just given the volatility of this industry. Providers are kind of opening and closing all the time. So one way we're working to help enable employers to be more helpful in those conversations is through the launch of our early learning marketplace, which we're signing up early adopter providers right now. But it's basically an open table, if you've ever used that to reserve a seat at a restaurant. It's that for early care and education. And so providers are going to be able to say, here's my current real-time availability, and families can go on and reserve seats online. So we're working with providers right now to get them involved, and families will come next later this year. So we hope that will be a help to all employers and their employees.
Yeah, that's right. And, it's interesting too. I think we all collectively need to do a better job anyway of that communication. But I think thinking of it differently too, and engaging with community stakeholders who typically have spaces and platforms where even our team members, when not at work, are engaging is another opportunity to, I think, get information out. And I'm not sure we've done a great job of tapping into that as a resource by way of communication. And letting folks know what, as anchor institutions, we have as a resource for not only our team members, but in many cases the community as well, which is something that hopefully we do a better job moving forward. But I think that will help us tell that story in a way, right, that makes sense. Because oftentimes too, it's not a matter of the information not being there. It's how did you get it to the person who needs it, and in your delivery, did it make sense? English comes in a ton of different variations, and depending on how you deliver that message, the person might not receive it as well as someone who, when their hair is down, and they're spending time with, they might receive it a little bit better. So hopefully we do a better job in that moving forward.
Well, I will just then ask each of you, for the employers that are tuning in today, what are kind of the last words of wisdom and advice that you would provide to them about how they can help their employees access better high quality early learning, and maybe even take a page out of IU Health's book and go beyond your employee into the community to make sure that high quality early learning is available to all. So I'll start with you, Jamal. Words of wisdom, advice?
I'd say, hey, let's jump in, right? I mean, the first step is to actually step. So I'd say let's do it. It's going to be a collective effort. IU Health, Cummins, we can't tackle this on our own. And regardless of what size you are, there's a role that you can play. And I would say be intentional about your effort. I think when we start talking about diversity and inclusion, a lot of that is just being honest and intentional about the things you do. So as we talked about, for example, just what the program looks like as it's rolled out. Are you conscious and intentional about that being reflective of not just your team members, but the communities that you serve? So I'd say start there, and let's do it all together, and we'll figure it out.
Great. Carolyn, how about you?
I love what Jamal said about being intentional and collaborating. And I love what our CEO says about the space of equity and racial equity in particular, and that is no more neutral. And that goes along with being intentional, that goes along with being committed, that goes along with centering, as you said, Maureen, those most impacted. Being empathetic and understanding what it is our employees need, what individuals in our communities needs are, and being committed and intentional to continuing to advocate, ensure access and equity.
Thanks. Maureen, how about you?
I think I'm liking Jamal's take a step and get involved. And I will say, just to reiterate, really, regardless of the size or the type of work that you do, first of all, it's probably a challenge that some of your team members are facing. There are resources available to help, and you have a role to play.
Great. Thank you. Well, we hope today's panel has provided you with inspiration and specific action items that you feel like apply to your organization that you can take back and start to implement if you're not already providing one of that list of menu options that Maureen walked through. The Indy Chamber will send a follow-up email with links to additional resources, including some of the studies that Maureen mentioned in that new Open Table app, which I'm going to check out. That sounds pretty cool. And then also contact information so that employers know how to go about taking next steps. So please join me in thanking our excellent panelists, Maureen Weber, President and CEO of Early Learning Indiana, Carolyn Butler-Lee, Vice President of Diversity and Inclusion at Cummins, and Jamal Smith, Director of Strategic Partnerships at IU Health. Thank you so much for your time, the work that you're already doing, the inspiration you provided to me and the folks who tuned in today, and for being with us today. We really appreciate your time and everything that you're doing.
Absolutely. Thank you.
Thanks for having me.
Your leadership.
I want to thank you all for taking the time to join us. I want to thank all of the Learning and Talent Task Force members and panelists who contributed their time and expertise today. One of the things we're trying to accomplish today is to let you know about all of the resources that you can tap into to be the change for Black and Hispanic students and adults in our community with specific ideas and resources. We hope we covered some things that are very actionable for your company or your organization. Again, I want to thank all of the panelists, the Richard M. Fairbanks Foundation, and all who have committed their time so far to this cause. We're trying to build almost a community of practice because we've realized as a business organization, even though we're on our own journey of getting better, supporting more inclusive economic growth, many of our members and businesses in the Indianapolis region are counting on us and our partners to help them navigate. And so I really, really hope that we've triggered a lot of ideas for your company to get more engaged in this work. So we've got one more slide with some contact information so we can help keep you connected to this work so that you can remain engaged and learn more about implementing these racial equity strategies in your company or organization. We're going to ask you to fill out the Learning and Talent Implementation Form on our BEI website, or click the QR code that's provided right here on this slide. So you can find it on the BEI website or the QR code that's provided. We're also inviting our, literally hundreds of Indy Chamber members and other Central Indiana employers to visit the Business Equity for Indy website to view the recording of today's event. So if you heard something you thought was interesting and you're thinking, oh, I've got a colleague that really needs to hear this message, that will be provided immediately on that website. And that website is businessequityindy.com. That's businessequityindy.com. While you're there, you can explore the other Business Equity for Indy task forces, sign up to stay informed about other BEI events, and explore stories from other regional businesses who have stepped up their commitment to diversity, equity, and inclusion. It's a really exciting time. There are a lot of great companies and organizations doing great work. So if you're a company thinking, I don't even know where to start, we want to be a clearinghouse for that and make a connection to a company who has put that kind of a strategy in place, or maybe it's a community organization that your company can partner with. Anyway, we're incredibly grateful for all the time that you took today. So thank you to the Learning and Talent Task Force members, all of our panelists. Please go to businessequityindy.com. We look forward to continuing the conversation. Thank you so much.